Hi class, this is section 3 and this is going to be on renal failure. So we're going to talk about some different problems with the kidneys, different diseases, renal failure. But in order to understand what's happening inside that renal system, there are 3 ways we kind of look at what's causing these problems. And the 3 ways that these problems can be caused is prerenal, intrarenal or intrinsic, or postrenal. So prerenal would be something that occurs before the blood circulation gets to the kidneys. So this could be something like a disease, heart failure, liver failure. If someone has massive fluid loss or blood loss, causing dehydration or lack of blood and fluid to the kidneys. This is all happening before the blood reaches the kidneys, and then the kidneys respond to the problem that's happening prior. We're going to talk about examples of these. Intrarenal would be something that's happening within the kidneys, and that could even be some kidney stone that is in the kidney. It could be a damaged glomerulus inside that kidney, diseases of the tubules, of the nephrons. So it's happening within that kidney. Postrenal means that it's something happening after the blood flow of the kidneys. It could be a kidney stone that's inside the ureter. So that would be below the kidney, and that would cause fluid to back up and damage the kidneys, right? A urinary tract infection or something having something with the prostate that's infected, that's impacting the flow of urine. So take a look at this and in your mind really focus on when we talk about these different problems, is this happening prerenal, intrarenal, and postrenal? So one problem that is intrarenal or intrinsic is glomerulonephritis. Nephritis is inflammation of those nephrons, and of course we know what the glomerulus is. So it's the inflammation, damage of that glomerulus. So when the glomerulus is damaged, then that causes the, as we talked about earlier, as you might have read in your book or we talked about, the nephrons filter all kinds of different products, electrolytes and some non-electrolyte things, such as water. So normally the nephrons don't filter blood or protein. But if there's damage to that glomerulus, sometimes the blood can actually get through into the Bowman's capsule and flow through those tubules and come out, and then there would be blood in the urine. And that can happen as well with protein. And one of the main causes of glomerulonephritis is streptococcus. So, for example, if a young child has strep throat and it's not treated, there can be inflammation, a body systemic inflammation that can occur from it not being treated, and the glomerulus can get inflamed, and some antigens can get in there and cause damage to the glomerulus. Not necessarily the streptococcus bacteria, but the antigens. So we can see this disease in young people because of streptococcus. So let's look at some of the symptoms. Another problem that can cause kidney failure, renal failure, or kidney stones or calculi. We typically hear that kidney stones are made up of calcium, but that's not necessarily all of them. It is a major component of many stones, but they can be made up of different components. Calcium is the most common one, though. They can be located inside the kidney. Inside the kidney would be what? Would that be prerenal, intrarenal, or postrenal if it was inside the kidney? A kidney stone. That would be intrarenal. And then what if the kidney stone was located in the ureter? Would that be prerenal, intrarenal, or postrenal? So if it was located in the ureter, that would be postrenal. And so they can they can cause a lot of problems if they're not removed or if they're not passed. Two major problems are, one is infection. It can lead to an infection of the kidney. That infection of the kidney is going to lead to inflammation of the glomerulus. Inflammation of the glomerulus is going to lead to one of the syndromes, and it could also lead to a permanently damaged kidney. And it also could lead to hydronephrosis. Hydronephrosis, hydro meaning water, neph. So there's acute renal failure and chronic renal failure. And acute and chronic are the same throughout healthcare in all the different ways that we talk about the human body. So acute renal failure is when it happens quickly. It's acute. It's serious. So, for example, if someone is hemorrhaging to death, then the kidneys are going to sense the low blood pressure, and they're going to secrete renin, which is going to get the renin-angiotensin 1 to angiotensin 2 process going, which is going to increase the blood pressure and cause vasoconstriction. But the kidneys can only do this for so long. If someone is hemorrhaging to death and there's not enough oxygen coming to the kidneys, then the kidney is eventually going to die. Well, how do we cure this? Simply, we stop the problem. So if someone is bleeding to death because they got their arm severed in a car accident, say, put a tourniquet around that part so that the blood won't continue to leak out, and what the kidney's trying to do to compensate will be working. And then we need to give fluids to our patients so they can, and maybe a blood transfusion, and get our bodies, the body needs to be oxygenated well with increased blood volume. So it's acute because it can be reversed if the problem is found quickly. So some of the problems that can cause renal failure are nephrotoxins. So nephro meaning kidney, and toxins meaning they're harmful. So there are many drugs, many toxins that can actually cause damage to the kidneys. And I'm not going to go through all of these, and I don't think you need to know all of these, but just know that there are certain toxins like medications. So for example, if someone is taking a blood pressure medication and they're not managing their blood pressure, but they're continuing to take the medication, they could be causing too much vasodilation, or if they're not taking medication and they have high blood pressure, they're taking medications to increase the blood pressure, it could be causing vasoconstriction, which is decreasing the blood flow to the kidneys, and this can cause damage. I touched on ischemia. Ischemia means when the tissues are not getting the proper amount of oxygen. So if the kidneys are not getting blood flow, they're not going to stay alive. So if the person is bleeding out, then they're not going to get the blood flow that it needs to survive. So chronic renal failure is something that occurs over a long period of time, and usually many years. This is usually with older individuals. And because as we get older, we actually lose nephrons. And so our kidneys have to work a little harder. to filter. And then if we add insult to injury, for example, if we have a chronic disease, if we have, like we mentioned before, hypertension or diabetes or something that's causing renal insufficiency, then over time the kidneys can get necrotic. They can actually lose cells and start to get problematic for us. When the kidneys are so diseased and so broken down that they begin to not function, that would be called end-stage renal failure. And the person would need to have dialysis, and we talked about that in the previous lecture, because if the kidneys cannot filter, then our bodies get built up with toxins, too many electrolytes, too much water, and all of these things can cause problems such as crossing the blood-brain barrier and causing confusion, and we can die if we don't have these things filtered out. So signs and symptoms of chronic renal failure would just be your generalized nausea, anemia, fatigue, anorexia, bone marrow depression, and all of this is caused by an increase in the waste products in the blood. So if we draw blood on a patient and we see an increase in all of these electrolytes and waste materials, then we know that the kidneys are not functioning as like they should. So complete renal failure is going to be decreased urine output where it's not sufficient. Urine output should be 30 milliliters an hour in a person. We should see that. If we don't see 30 milliliters an hour, we know something is going on that is causing the kidneys not to function properly. Encephalopathy. Encephalopathy is a term used for confusion from the toxins crossing that blood-brain barrier, and it's common in liver disease too.